Sudogest is used for the temporary relief of stuffy nose and sinus pain/pressure caused by infection or other breathing illnesses such as hay fever, allergies, and bronchitis. It is a decongestant that works by narrowing the blood vessels to decrease swelling and congestion. If you are self-treating with this medication, it is important to read the manufacturer's package instructions carefully so you know when to consult your doctor or pharmacist. Cough and cold products have not been shown to be safe or effective in children younger than 6 years. Long-acting tablets/capsules are not recommended for use in children younger than 12 years. These products do not cure or shorten the length of the common cold and may cause serious side effects. To decrease the risk for serious side effects, carefully follow all dosage directions. Do not use this product to make a child sleepy. Do not give other cough and cold medication that might contain the same or similar decongestants. Ask the doctor or pharmacist about other ways to relieve cough and cold symptoms. When taking Sudogest, be sure to carefully read all the directions on the product package before using it. If you have any questions, consult your doctor or pharmacist. If your doctor has prescribed this medication, be sure to follow their instructions. Take Sudogest by mouth with or without food, typically every 4 to 6 hours as directed by the product package or your doctor. Do not exceed 4 doses in a day. The dosage will depend on your age, medical condition, and how you respond to the treatment. Do not increase your dose or take Sudogest more frequently than directed. If you are using the chewable tablets, be sure to chew each tablet well before swallowing. If you are using the liquid form, carefully measure the dose using a special measuring device or cup. Do not use a regular spoon as it may not provide the correct dose. There are various brands and forms of pseudoephedrine available, so it's important to follow the specific directions on your product package. Be sure to read the dosing instructions carefully for each product, as the amount of pseudoephedrine may differ. Do not exceed the recommended amount. Caffeine can increase the side effects of Sudogest, so it's best to avoid consuming large amounts of caffeine-containing beverages or products while using this medication. If your symptoms do not improve after 7 days, if they worsen or return, or if you experience a persistent headache, fever, rash, or believe you may have a serious medical issue, seek medical assistance immediately. If you experience nausea, vomiting, trouble sleeping, dizziness, headache, or nervousness while taking Sudogest, you should consult your doctor or pharmacist. Stop taking this medication and contact your doctor if you experience dizziness, nervousness, or trouble sleeping. It's important to note that your doctor has determined that the benefits of taking Sudogest outweigh the risk of potential side effects. Most people who use this medication do not experience serious side effects. However, you should stop taking Sudogest and contact your doctor immediately if you experience fast, irregular, or pounding heartbeat, changes in mental state or mood, shaking, or difficulty urinating. While rare, a serious allergic reaction to Sudogest can occur. Seek medical help if you notice symptoms such as rash, swelling, severe dizziness, or difficulty breathing. Remember that this is not a complete list of possible side effects. If you notice any other effects, be sure to consult your doctor or pharmacist. In the U.S., you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, contact Health Canada at 1-866-234-2345. Before taking Sudogest, it's important to talk to your doctor or pharmacist if you have any allergies or have had negative reactions to other similar medications. This product may contain inactive ingredients that could cause allergic reactions. If you have certain health conditions such as diabetes, glaucoma, heart problems, high blood pressure, kidney disease, overactive thyroid, or difficulty urinating, it's important to consult your doctor or pharmacist before using Sudogest. Sudogest may cause dizziness and can be intensified by alcohol or marijuana use. It's important to avoid driving, using machinery, or doing anything that requires alertness until you can do so safely. Limiting alcoholic beverages is also recommended. Some forms of Sudogest may contain sugar, aspartame, or alcohol, so if you have diabetes, alcohol dependence, liver disease, phenylketonuria, or any other condition that requires you to limit or avoid these substances, it's important to talk to your doctor or pharmacist about using Sudogest safely. Before having surgery, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. Older adults may be more sensitive to the side effects of Sudogest, while children may be more sensitive to its effects, especially restlessness. If you are pregnant, Sudogest should only be used when clearly needed, and it's important to discuss the risks and benefits with your doctor. Sudogest also passes into breast milk, so consult your doctor before breastfeeding while using this medication. When taking Sudogest, it's important to be aware of possible drug interactions. This medication should not be taken with MAO inhibitors, as it may cause a serious and possibly fatal interaction. It's crucial to avoid MAO inhibitors such as isocarboxazid, linezolid, phenelzine, and others while using Sudogest. Additionally, it's important to check the labels of all your medications, as they may contain similar ingredients to Sudogest. Always consult with your doctor or pharmacist before starting or stopping any medications. Keep in mind that Sudogest is commonly found in allergy or cough and cold products, so it's essential to use these products safely and as directed. If someone takes too much Sudogest and experiences severe symptoms like fainting or difficulty breathing, it's important to call for emergency help immediately. In the U.S., you can contact the local poison control center at 1-800-222-1222. Canadian residents should call their provincial poison control center. Symptoms of an overdose may include slow or shallow breathing, hallucinations, and seizures. Remember, Sudogest is only meant for short-term use. It's important not to take it for more than 7 days without talking to your doctor first. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose at the usual time. Don't take a double dose to make up for the missed one. When it comes to storing Sudogest, it's important to follow the specific instructions on the product package or ask your pharmacist for advice. Make sure to keep all medications out of reach of children and pets. When it comes to disposing of Sudogest, do not flush it down the toilet or pour it into a drain unless directed. Instead, properly discard the product when it's expired or no longer needed. It's a good idea to consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.